Everyone ready? Thanks for coming along. Nearly everyone ready? Good work. Okay, thank you for coming along. Just to update the Victorian community on the status of the cluster that is currently underway in Victoria. So currently there are 29 total active cases in Victoria. That's an increase of 12 new cases since we reported yesterday. This includes 10 locally acquired cases, all of which are linked to the Black Rock cluster. Two of these include the New South Wales cases that the New South Wales colleagues announced yesterday, but are now back in Melbourne, completely appropriately, and are isolating here. So that means a further 2 of the cases, to bring it to 12, are in hotel quarantine. One was a member of an international air crew, and one was an international returned traveller. I can also confirm that genomic sequencing results have been received from the samples from the Victorian outbreak. That has established that they are directly linked to the New South Wales cluster. There's been a total of 3,907,338 tests received. That's an increase as of the cut-off time last night of 18,337, and there are many thousands still working their way through the lab overnight. I want to thank our pathology and lab teams for stepping up to extended hours as they have. I want to also address both the border issue and the testing issues. So the border issue is now pretty settled. The Victorian border to New South Wales is closed. I want to thank the 900 Victoria Police and SES volunteers who have been working continuously to keep Victorians safe from the cluster that has been seeded from New South Wales into Victoria. I want to also acknowledge that the border closure, based on public health advice, has caused significant disruption for returning travellers, and regrettably will also cause disruption for our border communities. As I think I indicated yesterday, we've been quite consistent for some time now, for 2 weeks in fact, that the deteriorating position in New South Wales was of significant concern, and that the public health advice was likely to change very quickly in a rapidly changing public health environment. So we make no apologies for closing the border. It was based on the public health advice, but I do acknowledge the significant disruption and the significant implications that that has made. And we intend to work with the Cross-Border Commissioner to land precisely what the bubble arrangements will be in the next few days, as I indicated yesterday. But what we are clear about is that the existing arrangements, based on the economic and education and medical supports and other arrangements that are used to support those cross-border communities, will be maintained based on the driver's licence system as it's been implemented. In regards to the implications for returning travellers, the border is now closed to returning travellers. Jerome will go through the arrangements as to transit permits, which are now in place for people transiting from other jurisdictions, the ACT, Queensland, etc., and also through the arrangements that will be in place for exemptions. But be clear, the border is closed for very good public health reasons, and we do not resile from that. And in regards to testing, I want to thank the more than 18,000 people who came forward yesterday. Testing is the most important thing we can do. I appreciate the significant frustrations, as on many occasions the advice from Victoria Police around traffic management and other issues was to manage people up to a certain point, and based on safety advice from police, to manage those by capping those arrangements. We're standing up a significant increased number of both hours and facilities today, and I would ask people to still come forward, but please be patient and understand the important role that you are playing in keeping yourself, your family and the rest of the Victorian community safe. In regards to other measures, we've seen recalling of staff to come back and assist in how we deliver some of these testing arrangements, how we make sure that the 190 sites that are now open and operating across the course of today will have extended hours in many instances. Can I urge people to visit the DHHS website, coronavirus.vic.gov.au, to monitor the best locations in which they should get tested. I want to thank again all of those Victorians who have come forward to be tested, and I want to urge you that if you've got the slightest of symptoms, to come forward and be tested. Now that we are seeing a total number of some 29 active cases across all of Victoria, including in hotel quarantining, this is a very significant issue for Victoria as we head into 2021. I want to also thank the hotel quarantine teams and the teams at the airport. We are doing an extraordinary job in making sure that those people who show up unauthorised from interstate are dealt with. Jerome will go into the number of people who have been forcibly and compulsorily detained in hotel quarantining. I did want to make particular mention of two people who absconded from discussions with authorised officers yesterday, who have now apparently returned to Goulburn in New South Wales. Upon the advice of the public health team, those people have breached numerous orders of the public health state of emergency in Victoria, and they will each be fined at least $19,000 for their breaching of those arrangements. This is a very serious matter. We've established the link between New South Wales cluster and this outbreak here in Victoria. We are determined to get on top of it, and I know that requires what appears to some people to be tough measures. But the virus does not respect state borders, the virus does not respect holiday periods, and the virus does not respect many things. And we need to make sure that we stay ahead of this cluster, and we take all the necessary measures we can to make sure that we bring it under control as soon as possible. I'm confident we will. I want to thank all Victorians, all our frontline officials, all of the Victorians who have come forward to get tested, and I want to acknowledge the disruption and the contribution that returning travellers, border communities and others are making to keeping us safe. I might ask Jerome to go into a bit more detail about some of these matters.
Thank you, Minister. Good morning. Just to confirm on the cases we identified overnight, we now have the 10 additional cases in the Mento Mitcham cluster. They are very much centred around the Black Rock Cafe that we've been talking about over the last few days. That brings to a total of 18 connected cases associated with that particular cafe, spreading out across a significant geography. That includes now a positive case in Leongatha. Of course, it also includes positive cases who, although they are now back in Melbourne, did travel to Lakes Entrance and New South Wales during their infectious period. As a result of that, we have a number of additional exposure sites that have been identified on the DHS website. I would urge everybody to go in, check and keep a close eye on those exposure sites. It is imperative that anybody who has been to those exposure sites during the dates identified on our website, that they do go and get tested today, and I'll come back to that in a moment. Exposure sites in particular now around Lakes Entrance and Strathbogie. We have exposure sites in Cheltenham, Moorabbin, Oakley, Brighton and Mentone. We also have exposure sites in Leongatha, and emerging overnight from the two cases we identified late last night, interviews are still ongoing. There are likely to be exposure sites in Camberwell that will be listed later on during the course of today. I highlight these locations because this shows the spread now that we have within this particular cluster. The positive development is that all the new positive cases, the 10 new positive cases, adding to the 8 we already had, are all within the defined close contacts of this cluster. So at this point in time, all these cases are linked, and as the Minister said, the genomic sequencing shows that they are connected to the original Northern Beaches Croydon cluster in New South Wales. We of course continue around the clock our detective work around identifying the exact link between the New South Wales cluster and the index cases that we have now here in Melbourne and Victoria, and we'll continue that work over the coming hours and days. We now have around 220 primary close contacts. That's an increase of 50 from yesterday. All of those primary close contacts are isolating and secured. They've all been interviewed. Those discussions of course continue as they do with in turn with their wider secondary contacts, and we'll continue to update those numbers over the coming days ahead. I'd also like to thank in particular the management and the staff around the exposure locations. We've had some fantastic cooperation from the Black Rock Cafe, from the church in Doveton, and a number of other locations. And I appreciate again for those locations we've identified in the last 24 hours, how significant and distressing it'll be to have these locations identified. And I thank them for their cooperation and their hard work, particularly around the QR code system, making sure they've got accurate records so we can speed up and activate our contact tracing. And that of course shows how significantly and how quickly we have managed to follow and develop this particular cluster, with 220 now primary close contacts all isolating, and of course their secondary contacts in turn doing the right thing. A brief word also on the border arrangements. So as the Minister has said, the border from New South Wales to Victoria is now closed. We of course continue to operate the border community bubble, so for all residents in the LGAs on either side of the Murray are able to travel freely across the border to ensure to protect the vital economic, work, living, education and medical linkages that we have in place. There are of course clear exemptions for essential workers, medical staff and so on that are in place. In addition, I would highlight to anybody who is still in New South Wales who has an important personal or special needs to come back into Victoria, there is an exemption process in place. If you contact DHHS on the COVID hotline 1800 675 398 or go through our website, you will be able to go through an exemption application process. I hasten to add, every single exemption will be reviewed by the Chief Health Officer or their delegate. This process will take at least 24 to 48 hours. You'll need to provide, of course, the necessary evidence and documentation to demonstrate why you need to come back into Victoria. And we will, of course, discuss with you in that case what additional measures you would need to undertake in order to limit any, to ensure any protection to the wider Victorian community. I say that because it's very important now that anybody who is still in New South Wales who has a particular need or desire to come back into Victoria, do not come to the border. Do not get on a plane and try and get to the airport. You will be turned back. You will not be able to apply for an exemption at the border. You will not be able to apply for an exemption at the airport. You need to apply online beforehand, wherever you are now. It'll take at least 24 to 48 hours to have that exemption reviewed, to have the conversations with you, and to agree whether you can or cannot come back into the state and under what conditions or circumstances. This includes anybody who believes they need to go into mandatory hotel quarantine. You will need to go through the exemptions process in order to access mandatory hotel quarantine. So I stress again, we are very keen to support those people who have a genuine need to come back into the state at this time. I absolutely understand how complex and distressing it will be for some people to have been caught on the wrong side of the border. We are there to help those cases who have a genuine need to come back. That's why the exemption process is there. I would ask people, please, before you move from where you are at this point in time, check out the exemptions process, go through that process and ensure that you've got the right documentation and approvals before you come anywhere near the border or anywhere near an airplane. A final point with regard to exemptions, those people who do or who are granted exemptions will be directed to specific crossing points. They will not be able to turn up wherever they choose. They'll be directed to specific crossing points depending on their circumstances and on their location. Finally, with regard to testing, again, I'd like to thank the literally thousands of people, the thousands, particularly frontline clinical staff, the traffic managers and everybody who's been involved in standing up our additional testing capacity over the last 36 hours and over this weekend. I know it was very, very busy at many of our testing stations across the state yesterday, both in the north of the state with returning travellers and also in the wider metropolitan area. In fact, every one of our stations was very busy. I apologise for the extended delays that we had in place, and I'm sure people will appreciate that particularly on a holiday weekend, we had a number of people coming back in, hundreds of people coming back in from their planned leave, and they continue to come back in from their planned leave today. As the Minister has said, we have more sites open today. We have additional pop-up sites operating, particularly around the Doveton Church, at the State Basketball Centre, in Abbott Street in Sandringham, and a number of other locations. Full details are on our website. And again, I'd encourage you, if you have any symptoms today, if you have returned from New South Wales recently and have not yet been tested, please go and get tested today. Please check out our website for the nearest and the most convenient testing stations. They will be busy again today. We had people queuing up from 7 o'clock this morning. I thank them for their planning ahead. Please, again, if you are going to get tested today, if you need to get tested today, then make sure you're prepared with water and diversionary material to wait out the queues that will be there. It is important, and we're seeing a fantastic response from the Victorian community. And as we saw through our second wave, it is by working together, it is by people getting out and getting tested, it is by all the work we're doing on the border that we collectively work together to get on top of this particular outbreak, as we surely will. Final couple of comments from me. We've taken an additional 70 people into mandatory hotel quarantine, 70 from yesterday. Again, I highlight from here on in, people need to go through our exemptions process in order to access either emergency access to the state or to access a mandatory hotel quarantine. Again, details on our website or on our COVID hotline. And finally, I'd like to thank all of our the frontline workers, particularly in our health services and in our aged care sector. We have activated, given the significance of this risk, we have activated the first tier of our response, both across our health services and in the aged care sector. That means it'll be essential visits only to those facilities to ensure, of course, we protect the most vulnerable in our society. This is all part of our swift, responsive and progressive plan to ensure we manage as much of the risk as we possibly can to get on top of this particular outbreak and to run it to ground. Thank you very much indeed. We'll take any questions.
Just a quick question on borders. A few people have been in contact. Victorians that rushed back yesterday.
Yeah.
Flew in with the expectation that they would be able to quarantine at home. They arrived around 4 o'clock and they've been put into hotel quarantine. Obviously, I don't have any more details on that, but do you know why that is the case? They had the expectation that they could quarantine at home.
Yeah, so again, we did see, as I said, we had around 70 people, 70, turning up at the airport yesterday on a variety of flights with a variety of documentation. Of the 70 individuals that went into hotel quarantine, they were not able to establish that they had the necessary permits in place that would allow them to quarantine at home for 14 days. Those individuals have been taken into mandatory hotel quarantine. We will work with them over the next few days to establish whether they can safely isolate at home, if that is indeed possible. That'll be a judgment we make on a case-by-case basis. This highlights again the importance of the exemptions process and, of course, the rules we've put in place. The border had to close because we were concerned about the risk of importing the virus from New South Wales into Victoria, as has already happened. As such, we need to ensure that anybody who's coming out of New South Wales does undertake the appropriate isolation arrangements depending on where they've been and when they entered back into the state. We're already in contact with everybody who crossed the border in the last couple of days. We will continue to follow up with those individuals to ensure that they understand their isolation requirements and they understand they need to get tested. And we'll be watching very closely for their test results to come through our systems to ensure that everyone's done the right thing. No, we're collating the numbers at the moment, and I'll be able to update those tomorrow.
Genomic sequencing showing us that New South Wales, does that mean that
No. So at this point in time, what we are confident of that we have genomic sequencing for some of the earlier cases in this cluster of now 18 positive cases. We're very, very clear on the connections between the 18 positive cases, and we've now connected those initial cases genomically to the outbreak in Northern Beaches and in Croydon. So we know that was ultimately where that we've essentially seen the outbreak here in Melbourne originate or be extended to from the Northern Beaches and Croydon clusters. We have not yet identified the individual connection point between the New South Wales outbreak and ourselves. That work continues at this point. We have a number of individuals that we're obviously following up very closely to understand their travel patterns and their close contacts and their secondary contacts to establish that bridge.
How much of a relief was it to get that connection to New South Wales confirmed rather than beginning with something else?
Oh, look, I mean, I think at the end of the day, we're all of us, both here, both in New South Wales and in Victoria, we're all dealing with one outbreak. We're all working together to get this outbreak under control for the benefit of not only the Victorian community, but the whole of the eastern seaboard. So look, we are all in this together. We need to get this outbreak to ground. It is obviously reassuring to understand where it originated from, so we know we don't have any other unknown sources of transmission happening within the state. But I stress again, we know that the 21st of December was the first known contact point within Victoria. That is now 11, 12 days ago. We are very keen to establish any other change of transmission that may be happening, and until we find that absolute connection point, we'll have to continue to search very hard indeed.
Are there new cases today? Are they other people who are in the restaurant? Are they staff? Are they people who are at the church
Yeah.
service? What do we know?
So of the additional cases today, some of them were individuals who were in the restaurant. Some of them, one of them is a staff member in the restaurant. One is a close contact of a staff member in the restaurant. I think we have now around 7 or 8 people who were in the restaurant itself. So out of the cluster of 18, we have at least 7 people who were in the restaurant and who have now become positive. Of course, there are other close contacts who were in the restaurant at the same time. And then around, I believe, 10 of the current positive cases who were not physically in the restaurant at that time, but who have been close contacts.
So no other, sorry, no other
Yeah.
cases about that the other exposure sites, those high-risk ones you mentioned yesterday, no other cases there, it's just the restaurant?
That's right. So at this point in time, all the transmission, the initial source of transmission, so the restaurant accounts for at least 7 cases, which were who were people who were in the restaurant during the time window that we've been talking about on the 21st of December. The other cases are all very close contacts of those individuals at this point. We have not yet seen any positive cases emerge out of the other exposure sites that we've listed on our website, but I stress we have a lot of testing still happening of people who are in those locations. It is critical for all of those close contacts and all of those individuals at all of those exposure sites that they follow the direction to isolate and get tested. None of us is immune from this virus, and none of us is immune from the risk, and it's important that we continue to follow that train through.
Those new 8 cases, were they all already isolated?
Yes.
Just to confirm, there's no update on the serology report or either disproving or confirming the links
No, we're continuing to explore serology on a number of those other cases where people have tested negative. We're keen to understand whether they had any previous exposure to the infection. We're expecting those results in the next couple of days.
For people crossing the border, we heard of people getting turned away from multiple testing sites yesterday.
Yeah.
Again, it's looking like it'll be the same day. People were told they had 24 hours to go get tested. What are the penalties if that doesn't happen or if they can't get inside?
Now, look, clearly, what we're encouraging people who've crossed the border to do is go home and get tested and isolate for either until your negative test result or until 14 days, depending on when you cross the border. People were given very clear directions in terms of the permit that they received that applied to their personal circumstances. If people have not been able to get to a test centre yet, or if they've got to a test centre and they haven't been able to get to get through the queues, I would ask you to continue to do that today. And if you can't get through today, I would ask you to go and do it tomorrow. But isolate in the meantime until you do so. So we all understand, we all appreciate that we are seeing a lot of people coming forward and doing the right thing. So the 18,000 people who've already got their test results who came out and got tested yesterday, the thousands I've still got in the lab who will get their results during the course of this morning and early afternoon, they've done the right thing. I'm very grateful to them because we need to see those high testing numbers not only in our returning travellers so that we can rule them out from our investigations and that they know where they stand, but also with anybody else who's symptomatic in that wider area. And as I've said, we've got a large spatial spread now from Leongatha all the way to Lakes Entrance and just about every point in between. People need to be aware of their symptoms, and if you've got any concerns, go and get tested. I appreciate that some of the waiting times are long. We've got thousands of staff coming back in. We've got people coming in back from their holidays, from their leaves. We've redeployed people, but we just need everyone to work with us to get this critical job done.
So the people who are getting turned away, who are kind of in good faith trying to do the right thing, they're not going to cop a fine?
No, but equally, just because the queue's a bit long doesn't mean there's a reason not to bother getting tested and going to the beach instead. So, if you can't get through the queues, I'm going to ask you to isolate. And therefore, I would strongly urge people, as many people did this morning. They got out there early. They settled in for a couple of hours wait before the test centre opened. I appreciate that's not what we all want to do on a Saturday morning, but we really, as a community, need to go and get this one to ground. We get it to ground by getting out there and doing it quickly. As the Minister has said, we've got additional test sites open today. We've got additional people coming through those test sites today, but it will still take a while to process people. I'd ask you to bear with us and let's get through this together.
Are there checks between those who have come across the border referenced with those who have undergone testing?
Yes, so we validate all the test results against the permits that we've issued for getting over the border, and that allows us to do a pretty good match as to who's actually got the test results. More importantly, those who haven't yet got their test results, and we'll continue to work with those to make sure they do the right thing. We're also following up, so returning travellers, we'll expect to get phone calls and messages from us around making sure that they're still isolating, making sure they've got their test results, and for those that may not be as responsive, they can expect a knock on the door from our colleagues in either VicPol or our authorised officers.
And if they don't do what's required?
Oh well, there's a range of penalties available to us. I mean, ultimately, our job is, our expectation is people do the right thing. And look, a brief word to the thousands of people who sat in those long queues on New Year's Eve and on New Year's Day. Look, I'm really grateful to everybody who made that long journey. It was a slow journey, it was a challenging journey, and look, I absolutely appreciate the frustration you would have had in breaking up your holidays. But it's been so important for you to do that. I'm very grateful and thankful for the fact that people have gone out and come back and done the right thing. We now need to follow through. So getting back was the first thing, getting texted is the next thing, and then isolating is the final thing you must do to preserve the gains we've all made as a state.
The increase in capacity of testing today, you expect it to be 20% on what it was yesterday, or 50%? What do you expect?
Yeah, look, we've probably got around a 15 to 20% uplift in testing capacity across the state today compared to yesterday. What I would say is we expect our northern and regional sites to be a little bit quieter today, as we've obviously seen a lot of the returning travellers now get back to their place of residence. I expect the metropolitan suburban testing sites to be busier today than they were yesterday, and we saw some of the highest numbers we've ever seen through some of our sites yesterday, which is a credit to the people turning up and doing the right thing, and to the hard-working teams that were pushing people through.
Being told there's no bookings available until next week
Yeah.
to get tested. Is there any business capacity there?
There is. So there's additional capacity being put on, particularly within the Lakes Entrance area, also within the Bairnsdale area. We've extended our operating hours. And of course, of the 190 testing sites across the state, some of them operate on a booking system. The vast majority operate on a walk-up or a drive-through kind of service. So there's a range of options available. I'd encourage people to check the website, look for your local options available to you. If you've got any concerns, if you don't know what to do, give us a call on the COVID hotline, and we'll give you some really good tailored advice.
Do you feel like you're on, as much as possible, but do you feel as though we're on top of this?
Yeah, absolutely. I think collectively as Victorians, I think we're on top of this. If you look at the key measures we've got, we've been talking about this case now for the last couple of days. All the positive cases we've seen so far, 18, have all come out of that original close contact field. We've got strong and clear connections between all the positive cases. We've got a clear field of 220 primary close contacts who are isolating and doing the right thing. We've got a growing list of secondary contacts who are also being asked to do the right thing. We're getting great cooperation from the businesses and the exposure sites who've been running on the whole, a really good contact tracing arrangements and QR systems. And we've seen a great response from Victorians. And I know there's a lot of frustrated people coming home early from New South Wales. I know that was a long and difficult drive, but ultimately their response was to go and do the right thing. And we've seen the same thing in our testing centres over the last couple of days. So collectively, absolutely, I think we're on top of this. We're seeing the numbers. The numbers are significant. Let's be clear. We still have work to do to make sure we've got to the full range and depth of this particular outbreak. I would not exclude the possibility that we've got other chains of transmission out there that we haven't yet spotted. The sooner we can identify those and pull those up, the better this will be. And we've got work to do to run this one through. But at this point in time, I think we've made a very strong start. The job for all of us now, both within health, the health services, as well as across the state, is to maintain that momentum over the next few days.
Not a single one of these cases knew they were infected at Christmas. Lots of them didn't know they were infected on New Year's Eve. What gives you confidence that all of these people who spent that whole festive period with their family and friends, what gives you confidence that they're not going to show up in the next few days in very high numbers? None of these people are isolated.
That's right. So look, I think that's the whole point around what we expect to discover over the coming days. So one of the positive aspects of this development so far has been that we're getting fantastic cooperation from the close contacts. We're holding interviews for 4 or 5 hours with people as they're going through extensively their entire movements over the 10, 11 days that we are concerned about. But we know that people have had, people have obviously naturally travelled fairly extensively. They've seen lots of people over this holiday period. This is exactly the dynamic we expect to see. So we expect to see more activity. We expect to see more exposures. But that's why getting hold of the primary close contact has been so important. That's why it's been important to get hold of that wider field and to ensure that people do isolate and do the right thing.
One for the Minister, maybe. The AMA is saying that New South Wales has put the entire country at risk by not going hard enough, early enough on the pandemic there. What's your response to that?
Well, the AMA's position is up for the AMA. We work very closely with the AMA here in Victoria, and we thank them for their advocacy. In regards to any criticisms of any jurisdiction, that's a matter for the AMA. All I can say is that we continue to work very closely with our New South Wales colleagues. The matter of the 2 people associated with the Black Rock cluster who visited and got tested in New South Wales. They got tested in New South Wales because they got a call from our Victorian contact tracers when they were visiting on a day trip. And the cooperation between the 2 jurisdictions was exemplary. Within a matter of hours, that information was tested, shared, and those people were packed up and back on their way to quarantine in Victoria.
Do you think that, though, that New South Wales has put the rest of the country in danger by not going hard enough earlier?
I'm not here to criticise any other jurisdiction. What I'm focused on is having now identified that this new Victorian cluster originated from seeding from the North Shore, Croydon, now combined clusters. We have to deal with that. That's regrettable, but at this time of the year, with the time of the year where we have maximum movement of people across our communities, it couldn't be worse timed, frankly. But you don't get to pick these things in a global pandemic. This virus does not recognise our annual festive holiday season. Sadly, it will maximise its spread through that. That is why we had to take the tough measures of closing the border. That is why we've taken the tough measures of returning to that last step arrangements, of smaller private gatherings, of wearing face masks, and of increasingly locking down hundreds, soon to be thousands of people in isolation and quarantining.
The New South Wales Premier hasn't been as polite as you are being. She
Oh, well.
said yesterday that using the resources on the border was a waste of resources and would be better off putting them into extra testing.
Oh, I didn't see the New South Wales Premier's comments. I don't think Victorians take the view that keeping Victoria's borders as tight as possible from the source of this cluster is a bad use of our time and effort. I want to thank those 900 Victoria Police and SES volunteers who are out there in all kinds of weather doing that hard work to keep Victorians safe. I think that says a lot about the resilience and the determination of our frontline hard workers, be they police, be they quarantine hotel workers, be they our testing communities, be our pathology crews, all of whom are working 24/7, harder than ever, our contact tracers who have tracked down all of these cases in pretty rapid time and linked them all straight back to this cluster. The now genomic proof is in the pudding. This cluster originated from the combined North Shores Croydon outbreak. That's the science. And it's up to both Victoria and New South Wales to work together to get on top of it. And it will take some time, but the harder and the quicker we go, the quicker we will get on top of it. And I don't think Victorians would expect, given all that we've sacrificed last year, I don't think Victorians would expect anything else from the government that wants to keep their safety and their well-being as our first priority.
Those 2 travellers who came back who were at the airport and fled,
were they caught by police? Did they voluntarily return?
No, as I understand it, I think Victoria Police will have more to say about this shortly. You might well get an alert from them, and they'll have more to say about the details of the operation. But the advice I have is that these two people absconded from discussions with authorised officers at Melbourne Airport, having come in from Canberra. They did not have the appropriate declaration material, and they would have been heading straight into compulsory hotel quarantining. They absconded, disappeared in a vehicle, and were next heard of in Goulburn in New South Wales. We're working with the New South Wales authorities, but they will be facing at least a $19,000 fine each, and perhaps further breaches of Victoria's public health regulations.
Last question.
Clearly, Victoria's got some pretty real learned experience with what can happen, more so than other jurisdictions. Understand a lot of that, for better and worse, has been passed on from Victoria to New South Wales by yourself and the Chief Health Officers and so on. What was their reaction? Do you think they've adequately listened?
Through particularly AHPPC and the Health Ministers' forums and just the collegiate operations between the two contact tracing systems, the pathology work, there's an enormous amount of cooperation at that day-to-day practical level. But what we do know is that the history of transmission across both states has been very different. Victorians have learnt more than most how wildly infectious and easily moved around the community this virus is. And the fact that it's moved around at the time of the year when most people are moving around as well, it's hitched a ride. It's hitched a ride from New South Wales to Black Rock. We've yet to establish exactly the vehicle that it's done that, but we've established the science that that's what's happened. And then from there, so far, all the cases that have been identified have been able to link back to that cluster. And I think that speaks volumes, as you've indicated, of the learnings and the skills and the development of the Victorian response built up in the hardest of circumstances in 2020. Now, in New South Wales, it's different.
Followed the advice that they've been given based on our blueprint?
Well, like I say, we're not here to give New South Wales a lecture in how to go about suppressing the virus. New South Wales has a view, because of the way in which the transmission of chaining, of passing on the virus has occurred in New South Wales has been different. This time around, it seems to have leaked out of hotel quarantining in New South Wales into the Northern Beaches, into the Croydon community, and now down to Melbourne. As a result of the learnings that we've gone through, we take a view that the responses we've put in place are proportionate and fair. Yes, they're tough, and yes, they've caused a lot of disruption, and I understand the frustration that that disruption has caused, but that is nothing compared to the potential frustration if this wave, if this cluster grows to a further level. And we are determined to, over the next coming days and weeks, because it'll take a bit of time, to make sure that we take all the necessary measures to get on top of this as quickly as we possibly can. And the cooperation with New South Wales has been an important part of that.
Given Jerome said that Victoria is getting on top of this, would you be hopeful or confident that no further restrictions will be needed?
We'll continue to take the public health advice and be based on the science will be our response. I think I've asked this question before. I can't rule out further measures. If the science and the advice changes, then our response will change. The important thing is to stay ahead of this virus's growth in the cluster that's been established around the Black Rock community. So far, early days, thanks particularly to the hard work of our contact tracers, they've run down every single case. But the more work they do, because of the time of year we're in, the more contacts that's establishing. So we have to run harder and we have to run faster to keep ahead of this. And if the public health advice is that there are more measures needed to be taken to stay ahead of this, then that's exactly what we'll do.
Will you give the public some sort of expectation on what kinds of things you need to see happen in this outbreak before restrictions are put back on? Will there need to be mystery cases? Will the outbreak need to grow to a certain size? Because people are on edge and people are wondering when the next announcement will be that's going to curtail their freedom. Is that something that you consider doing in the future?
Look, I thank Victorian communities for their wonderful support for these measures. We know whether it's through QR codes, the reduction in public gatherings, private gatherings, the wearing of face masks, Victorians have a lot at stake here, and we will give Victorian communities, if there are further measures to be taken, as much notice as we possibly can. But as we've indicated, when we indicated to the measures in New South Wales, there are tough, quick decisions that have had to be made so far. We don't rule out having to take tough further decisions into the future, but I've got no more to add to that today because the advice hasn't changed. We're confident that the improvements, the skills, the numbers of our contact tracers, the systems, particularly the digitising, the end-to-end supports, the measures that we've put in place to increase the testing of facilities right across both metropolitan Melbourne and the regions. There's always more to be done, but we know that so far we're staying ahead of this. All the known cases have all been able to be drawn directly back to the Black Rock cluster, and I think that's a significant vindication of the efforts, but things can and do change. Okay, thanks everyone.